There are many different ways of organizing health policy initiatives, and the SURE project's 7 African country partners have organized themselves in distinctly different ways. Some have a relationship or position within a leading university, some are connected to the government, and one initiative is part of civil society. Each of these initiatives has different staffing levels and skill mixes to draw upon, widely different financial and governance arrangements, and varying partnerships with other national, regional, and international organizations. There are many different types of activities an evidence-informed health policy initiative might pursue. These include the generation of relevant and reliable research, priority setting for health system and policy research, capacity building, improving the public understanding of research, monitoring and evaluation of health system interventions, databases and access to research, clearing houses, authoring evidence briefs for policy and hosting policy dialogues, rapid response services, policymaker training, informing and engaging stakeholders, providing technical support to policymakers and other stakeholders, modifying political structures and processes so that they are supportive of evidence-informed health policy, advancing legislation or policies requiring evaluation, and evaluation of the effects of evidence-informed health policy, supportive political structures and processes.
There is a diversity of arrangement in terms of where should be this unit or how should the platform be shaped to get the best of these activities. As this is a new domain, we still have questions on should we be located within university or within the Ministry of Health or standing alone as a third party organization.
The advantages of Zamfo being an independent institution, that is being independent from ministry or independent from a university, is that it presents a neutral ground for different stakeholders on different sides or with different perspectives to be able to come into the same room and discuss a priority topic.
Standing as an NGO had some advantages, but in many countries there is still a question around what is the agenda behind all the NGOs.
The disadvantage, if I may just mention one, is when it comes to funding. If it's an independent organization, the organization is entirely dependent on external funding. Whereas if it was in a public institution, it's a part of that particular public institution's core business, and therefore it's funded within that particular institution's action plan.
Nous, on a la chance d'avoir le conseiller du ministre dans notre groupe, et nous avons aussi la chance d'avoir le directeur des études et de la planification, qui était notre socle. Et c'est la direction, c'est le poumon du ministère, donc il connaît les préoccupations et les préoccupations urgentes aussi. Ça nous a permis d'avancer.
Having the unit completely embedded within the Ministry of Health kind of create suspicion from civil society organization, and the relationship with the researcher can be challenge. I would say we have the ideal location, being in a teaching hospital. So we had the advantage of being at the university, but also being located in a hospital linked to the Ministry of Health. So we have some advantage that we could easily access researchers from the university, but we have direct access to the Ministry of Health as well.
For a knowledge translation platform that's just starting up, you're in for a lot of hard work. It's a lot of hard work getting started, getting trusted, getting to know who your champions are for particular topics. But in the end, it's really fulfilling.